Well, hello. My name is Kelly Miners, and this is, I think, my sixth class in the program. I'm excited to do my introduction video, and I'm excited to have this class because I think it's going to be very, very beneficial um, for my future. So, my history of nursing. So, I started college. I graduated high school in 1991 and started college right after. I started as a biology major and switched to nursing. And I started nursing classes at the beginning of my junior year. For the summer of 1998, I was a GI technician in a GI clinic, which I loved and learned a lot. That was my kind of first hospital type job. And then in the summer of 1999, I did a internship at the Mayo Clinic on a medical surgical floor. And that was very, very interesting. It was at Rochester, Minnesota. It was three months long. Took care of lots and lots of different patients. I remember having a patient with 12 drains and learning how to take care of all of that stuff. So then in 2000, I graduated with my BSN in nursing, and I went back to the Mayo Clinic and worked on that same floor where I did my internship for not quite 2 years. I only lasted 1 year of Minnesota winter, and then I moved back to Omaha, Nebraska, for, which is where I was from, and I started working in a large ICU. It was a 33-bed ICU. We were a level 1 trauma center. We did lots of big surgeries. We did hearts. We did surgical. We did medical. We did so many different types of patients. I learned so much at that job. Did that for about 2.5 years, and then I decided to move back to Kansas City. So I moved back to Kansas City where I started working at St. Luke's Hospital in the neurosurgical ICU. And at that time, it was neurosurgical as far as aneurysms and hemorrhagic strokes, TBIs. It's also a surgical ICU and a trauma ICU. So we had lots of different kinds of patients. And then in 2012, it formed into an all neuro ICU. And so that would take ischemic strokes, hemorrhagic strokes, tumor excisions, craniotomies. We would also do TBIs and some of those traumas like that. I worked as a charge nurse, as a preceptor, and did all that in the unit. And then for 2 years, I was the clinical resource nurse, which was kind of like an assistant manager. I also helped to manage orientation for about 10 years in that space. Um, Finally, about a little over a year ago, I switched to system education, and I am now a system educator at St. Luke South in Anderson County. So, what attracted me to this area? So I would say my area of expertise is ICU. So for about 18 of my 20-year career, I've done ICU nursing. And I liked the busyness of it. I liked trying to figure out my patients. I liked looking through and analyzing all their labs and their vital signs and everything else. My favorite patients were those big traumas or those really, really septic patients or those patients that were vasospasming secondary to a aneurysm burst, and they were so sick and hemodynamically unstable. And those were my favorite patients to take care of. I also really enjoyed teaching other nurses how to take care of those patients. And so just the busyness, the ability to link my pathophysiology, the evidence-based practice that I have learned and read about into the clinical setting was my favorite thing to do. So my goals related to nursing education is mainly to have the knowledge and range to teach a variety of learners by utilizing different teaching strategies. So I've had a fair amount of experience, mainly in med surg and ICU, but now I've expanded my level of expertise to all these different areas. And so I'm learning so much in this new job. I'm helping with different things with long-term care and with clinics, also with at St. Luke South, a lot of the units are med surg based. So just trying to reach all these different kind of learners and so that they can have the best chance to safely take care of patients. I also want to give nurses the confidence and the ability to be able to look at a situation, to critically assess the situation, to know their resources, and to utilize those resources. My preferences for teaching related to medical surgical nursing are courses like basic stroke, some of your evidence-based practice classes, basic cardiac rhythm interpretation, basic communication. We do a big communication module in the nursing residency program, and preceptor education. I've been highly involved in preceptor education. I really like teaching others how to teach the new nurses. Also, simulations like with mock codes. We are also having a new way to do our certifications and doing quarterly certifications launch out at St. Luke's. And I really enjoy the evidence-based practice based on lower amount of information learned and higher frequency and more hands-on learning. So my peak out question I related it to the expectations of this course. So my P is going to be my student peers in this program. Um, in my I, so is going to be after completing the advanced clinical concept in nursing education, the student will acquire the knowledge needed to analyze educational deficits and apply educational theory to lessen this deficit in acute care settings. My C is going to be students that have completed the advanced clinical concepts in nursing education versus the students that have not completed this class. My O is going to be students that have successfully completed this course in advanced clinical concepts in nursing education will have a much more comprehensive and evidence-based educational plan that will decrease the knowledge gap much more than the master's prepared acute care educators. And the time frame is this 7-week class ending on December 12th. Thank you very much for listening to my presentation. I hope you enjoyed it and have a good day.